Hello, good afternoon, and welcome to this webinar on how to support your partner or someone close to you with depression. My name is Johanna Scholzo. I'm a business psychologist at Thrive, and this session will take around 30 minutes, and we will have time for questions in the end, which you can write in the Q&A function, and you may also share your own experiences and difficulties or helpful tips with other attendees in the chat function. So feel free to do that while we talk or in the end as well. So in this short webinar, you will learn how you can best support your partner who's maybe struggling with depression, and it can be overwhelming if your partner or someone you care for struggles with depression, and you might feel unsure or helpless about the suffering. So the aim of this session today is to empower you to offer the right support while taking care of your own well-being. And we will discuss signs and symptoms, causes of depression, different forms and severities, and helpful tips for you to offer support. So it's completely normal that we sometimes have a low mood and feel a little sad or down, and often depression is really hard to recognize. However, if your partner or someone you know is constantly feeling sad and cannot enjoy anything positive anymore for a longer period of time, your friend or partner might experience symptoms of depression, and unfortunately the probability that you know someone close to you who is affected by depression is very high, as 1 in 6 experience depression in any given week. So yeah, this is something which is good to know, I think. So how can you recognize signs and symptoms of depression? It may help you to understand more about the signs and symptoms of depression, so that you don't feel that it's your fault, that all of your efforts to make him or her feel better result in those automatic negative thoughts or social withdrawal. And people with depression show different symptoms, which can be from psychological, physiological, and social nature. And also each person's experience of depression is different. So psychological symptoms may include continuous low mood or sadness, hopelessness, emptiness, irritability or irritable difficulties in making decisions, low self-esteem, having no motivation, enjoyment to the things the person used to enjoy before, and in severe cases, even like suicidal thoughts. So physiological symptoms or physical symptoms include moving or speaking more slowly than usual, change in appetite, lack of energy, low sex drive, changes in the menstrual cycle, and disturbed sleep, likely finding it difficult to fall asleep at night or waking up very early in the morning, or just waking up quite often during the night. And finally, there are those social symptoms like avoiding contact with friends and taking part in fewer social activities, neglecting hobbies and interest, as well as having difficulties at home, work, or in the family life. So the problem is that these symptoms can act in a vicious cycle. And for example, when avoiding those social activities, people tend to feel worse as a result, and consequently will avoid social activities even more, and so on, right? So as depression can develop very slowly, your friend or partner might not recognize the signs, or does not want to acknowledge that he or she is not doing all right anymore. And consequently, you might end up in a situation where you first realize that help is required. And for example, your friend or partner tells you that that the sadness is eating them up from the inside, or she does not eat or sleep normally anymore. And maybe in severe cases, affected people with depression might believe that everyone is better off without them and they are a burden to others. And this is important to keep in mind, as depression is a disease and not a selfish behavior of intention seeking. And also for them, it may be too exhausting to do those small tasks. They neglect themselves, or their children appear tired all the time, and don't show interest anymore in the activities they earlier enjoyed doing, as I said before. So what causes depression? It can be very difficult to support someone with depression and not tell your friend or partner to pull himself together, right? It's quite hard for the person living with them, and especially if you, yeah, as I said, as you live together and you have a daily life together, it gets disturbed by your partner's sadness and negativity, right? And please keep in mind that it's really neither yours nor your partner's fault. Depression is as I said, is a disease caused by no single cause, but by multiple factors. And triggering factors may be linked to inherited genes. So if there's a family history, maybe chronic disease, stress, low self-esteem, loneliness, medication, drugs, anxiety disorder, traumatic experiences, or loss and bereavement. And something to note as well is that depression is more common in women and might be triggered by giving birth, for example, and other related risk factors are being under 30. And this is probably because, yeah, we have a lot of life changes happening when we're younger, right? So maybe the first job, moving out, going to university. So these like significant life changes have a strong impact on us and cause a lot of stress sometimes, or cause a lot of uncertainty. So they increase the risk as well. And other factors might be low income and unemployment. And yeah, something really here important is that the earlier we intervene with treatment after the onset of symptoms, the better maybe the prognosis for recovery. So therefore, please don't wait to seek the conversation due to insecurity, and offer your direct support in seeking professional help. And also, it may be helpful for you to know that there are multiple forms and severities of depression. So forms of depression include postnatal depression, which women may experience after having a baby, seasonal affective disorder, which we often experience during winter times, and bipolar disorder, which is characterized by changing episodes of depression and mania. And those manic episodes are characterized by a very high mood, and people often feel great, feel really great, and have a lot of energy and racing thoughts and little need for sleep. And symptoms of depression can range on a continuum. So from mild, having some impact on their daily life, to moderate and severe, where the person is unable to cope on a daily basis. And so why is it so hard to spot? So people with depression may function seemingly well to you or others. However, they might just pretend to be well, or fake their emotions in order to fit in and be accepted sometimes. Or affected people may learn to discard their emotions and rely on their willpower to function. So yeah, something to keep in mind. Sometimes it's really hard to see if someone shows symptoms of depression or not. And the thing here is that it's not your responsibility to diagnose or treat, but depending on the level and the previously outlined strength of symptoms, you may help the person or act accordingly, and offer support or signpost to professional support. So now we will talk about how you can best offer support for your partner or someone close to you. So the first thing I want to mention here is that let the person know that you care about him or her, and that you're listening. And it's just so essential that you show the person that you're there for him or her, and if she would like to talk about her feelings, that you're available. So even if you feel that you don't really know what to say, and this is sometimes the case, right? Because we don't know what to say, what the right words. Just encourage them to share their feelings, and do not force the discussion though, but sensitively try to encourage the person to open up. And depression is really like a recognized medical condition which needs attention and professional support, as any other like physical injury where we would immediately seek support, right, or go to the doctors. So sometimes it's also about encouraging the other person. It's okay to feel not all right and to seek support. And there's no, like, often people struggle with stigma, for example, or fear that they appear weak to others if they say they need they want support. So just encouraging that it's okay to talk about their feelings and to seek support is really essential here. And there are no right words, it's just about being there. And also it may be very difficult for the person to talk about their personal feelings, and especially often men find it more difficult. So you may want to offer words of encouragement, as I said before, such as, I've been feeling concerned about you lately, and you should know that I'm here for you. Is there anything I can support you with? Just some words you might want to use. Or even if you don't see each other, which is sometimes the case right now, right? If it's not your direct partner or someone just really close to you, but you can't see the person because of the lockdown. So even if you cannot see the person, keep in touch through phone calls, messages, or emails to show the person that that you care, and that you're there for them if they want to talk. And it's all about being there for the other without actually the need to talk about the issue itself. So sometimes people don't want to talk about it, but just really appreciate that you're around, and that you can talk about other things. Maybe just being there helps them really to have this support around them. Also show acceptance without any signs of judgment. So please remember that it's not personal and no one's fault. So if your partner or friend would rather be left alone or spend some time off, it's not because your partner does not like to be with you anymore. It may be his or her only accessible coping mechanism for the time being. And if you accept that you're already very supportive. And however, the other thing obviously is if you feel that your friend or partner is at risk for themselves, or for example their children, you may ignore their wish for loneliness and seek professional support for the person. So another thing is to encourage self-management. So outline the importance of physical exercise, eating a balanced diet, and doing things she used to enjoy. And you may, for example, encourage the person to do a workout together, or you ask them to cook their favorite meal together on an evening. Just maybe doing something together helps to find a bit more motivation, and helps them to do the things they used to enjoy actually. And also, like, it's just so important to not go. I talked before about this vicious cycle, right? Because if we stop doing these things, then we feel lower even more, and then obviously we tend to avoid those activities even more, and so on, so on. So just encouraging to stop this cycle and not make it worse is really, really helpful. Then other things you can do is also inform yourself about services available in the area. You can, for example, research psychological therapy services around you or depression support groups. There are great ones on the NHS website if you Google depression support groups, or on the Mind website. They're really good ones as well. So often people with depression don't seek help, and this is a big problem, right? So maybe all too much for them, or they fear of being judged. So without forcefully trying the other to seek help, have a general conversation about the need for help. It may help if you do the effort and search for support options in the area, as you know, like the information in the internet may be super overwhelming, especially for someone who's focused on all the negative aspects of life. So can help if they only have like two numbers or only one number in front of them, where you let them know, let's call them together, and not doing the task itself, like finding out, okay, which is the right number right now or what to look for, because there's a lot, and it might help them if you do the first initial search and help them to find the right support more directly. Also, another thing is that I mentioned that in the beginning, take care of yourself. And I think this is very essential. Even though your partner or friend might isolate themselves, try to keep up with seeing your friends and family as much as possible right now, obviously. But yeah, try to keep up with your daily life and the things you enjoy. And it's so important that you keep in mind that you cannot cure the person, but you can offer the support to the level you feel you can still cope with your own life. So really don't blame yourself if you cannot cope with the situation anymore, and allow yourself to ask for maybe consent to seek professional support for your partner, or maybe support for yourself. So there are also like really great support groups or available support outside, or communities where people who maybe not themselves are affected with the mental health issues, but just want to seek like this peer support who support others, right? So this might be really helpful as well. And it's really not a betrayal if you join a support group or talk to a counselor or a coach about your own emotions and feelings with the whole situation. So it's just really helpful, actually. So when should you seek professional support? And if your partner, so we talked before about the symptoms, right? So if your partner experiences 5 or more symptoms which endure for more than 2 weeks, as well as interfere with her life and daily routine, it may be good to really seek support for your friend or partner. And this might be a GP or other form of professional support. Often employers provide EAPs, employee assistance programs, which they can call anonymously. So there are various professional support options out there, and you might just encourage them to seek them out. But a GP is maybe a good starting point, and it may be very, very overwhelming for the person to do the first step, as we talked about before. And so maybe, and like, this picking up the phone, and so maybe just ask for consent to schedule an appointment, maybe for your partner or your friend, and provide the company during the visit if they like. So just offer it. So maybe they don't want that, that's fine as well, but some may really appreciate it, of not going there alone and having to drive there by themselves, for example. Or, yeah, as I said, just writing, like collecting, picking up the phone. So simple things for us sometimes are really overwhelming for the person affected. And treatment options for your partner may be suggested then, and they're, for example, antidepressants or cognitive behavioral therapy. So CBT is one of the most effective forms of therapy, and it shows really great results out there. Sometimes they combine both together, and depression comes with this comes with specific cognitive and behavioral symptoms, as we discussed before. So in CBT, one learns to train finding and changing faulty thought patterns, and it helps to get out of this unhelpful behavior cycle, and can be also accessed digitally through, for example, the Thrive app. So something to keep in mind. So they might not even have to have a regular counseling session for that. It can help, or it can be really grateful to really good to do it together, for example, so that people can continue doing it at home whenever they have the time. So if there's risk, so if the person you're worried about expresses suicidal feelings, you or they should contact a GP or NHS immediately. There are also other options like the Samaritans for confidential 24-hour support, or there's the Childline, which is really good for for children and young people, or the depression, the health talk is really helpful as well. So just immediate support then might be required, and this is just something which is really important. And there are also other resources. I will write them later when we're done in the chat, but it's just really helpful to look out for immediate support if you feel there's suicidal thoughts. This brings me already to the end of today's session. Just keep in mind that it's not your job to diagnose or your responsibility to make your partner feel better. And I think, this is just really what I want you to take away. And you may only offer support as best as you can, right? And you shouldn't forget to take care of your own well-being. So the thing is to be compassionate and to be supportive. We need to take care of our own needs and boundaries as well. This is just something we sometimes forget, because we think we put ourselves before someone else, but actually we are way more compassionate and able to support them if we are well as well. So this is something I really want you to take away from this session today. So I hope the session was helpful for you. Thank you very much for listening.